We also take you to other places to show you what's happening around the world and also give you other very important updates on the pandemic itself. And joining me today is Dr. John Nkengasong, the director of the Africa CDC. And the way that we will run our press brief as usual, he gives you a briefing and then we go into a Q&A session. And I will be giving you the details on how you can ask your questions. But the most obvious one is that you can write your name and number in the chat column, and then we will acknowledge you to ask your question. We do have a WhatsApp number that we regularly use, and I will be coming back to you with that one after the briefing by Dr. John. It's over to you.
Thank you, Wayne. And welcome, colleagues, to this week's press conference. As always, we like to sincerely appreciate what the media is doing. I mean, very important work that we continue to do with the media. And this week, I would start, first of all, with some highlights, and then of the week, and then go into the usual analysis of the epidemiological situation and some of the things that Africa CDC is doing. So first of all, I announced that the African Union Commission and Africa CDC will be hosting a 2 days virtual conference on COVID vaccine development and access next week, next Wednesday and Thursday, precisely June 24th and 25th. So the overall goal of this important virtual conference is to help us think through and agree as a continent on what will be a framework for Africa's leadership role in contributing to the development of COVID-19 vaccines, and also issues related to access. So in case there's a vaccine that is available, a COVID-19 vaccine that is available, how do we as a continent position ourselves to be to not be left behind? I think that is very important. We also will be discussing the role of the media and what the media should be doing, could be doing, working with us to make sure that the right messaging are transmitted around COVID vaccine 19 access and development, access and development. And then, of course, lastly, what are the barriers to access that we should be thinking of now and in anticipation of a potential vaccine? I think that is one major thing we like to highlight. The meeting will be chaired by His Excellency, the chairperson of the African Union Commission, Musa Faki Mohammed, and Dr. Tedros, the Director General of WHO in Geneva, Dr. Vera Songwe, the Executive Secretary of UNICA, Commissioner Amira Fadi Mohammed, the UNAIDS Executive Director Winnie Bayima, Dr. Moeti, and many others will be on that conference, participating at different levels at the conference next week. So we are really excited with that and looking forward to your full participation. The links are available for registration. I would strongly urge that the media be actively engaged. Segue to that will be that there will be a special session on media engagement, community, and civil society, because we take that very seriously. We know that, as we have discussed many times on this forum, that media participation to inform the community, engage the community, build that relationship and trust with it, and focus the issues where they ought to be, is very critical for us as we discuss vaccines. And all of these, access to vaccines and development, is part of our continental joint strategy, which you recall hinges on three things. One is to limit transmission of COVID-19. Second is to limit deaths. And lastly, to limit harm. And harm here is harm and the harm that may be on other diseases. So I think that is very, very important to highlight. The second thing I would like to highlight from last week is, as you all are aware, the head of states, the Bureau of the Head of States, and government met last Thursday under the leadership of President Cyril Ramaphosa and launched the platform for commodities, the African platform for medical commodities to fight COVID-19. So I think we are very excited with that. And I believe, if my understanding is correct, President Ramaphosa and the African Union chair will be having a press conference today at 6 p.m. Addis Ababa time, live, to discuss the platform, because it's a great innovation for our continental response strategy, and we are very proud of that, and especially the partnership with the private sector, specifically Mr. Strive Masiwa, who is the CEO of Econet, who helped develop that. I think that is mission to share with all of you. Let me then transition to the epidemiological situation. As of 9 a.m. East African time today, the global number of cases of COVID-19 have risen to over 8 million in about 200 countries, with, unfortunately, over 54 member states have reported, as of this morning, 267,519 cases. And of these cases, unfortunately, about 7,000 of them have died, and giving a fatality ratio, a case fatality ratio of 2.7%. There have been, fortunately, about 122,000 recoveries. Since the last briefing, that was between 11 and 17 June 2020, there have been about a 28% increase in the new cases. And if you translate that into actual numbers, it represents about 57,000 new cases compared to last week. So that is an average of about 8,000 new cases reported daily. If you think through this carefully, what we have been discussing here, last week we had around 6,000 new cases, the week before about 5,000 new cases, and this week about 8,000 new cases reported on daily basis there. So we are still on the ascending side of the pandemic curve for the continent. And if you look at that carefully and you begin to tease that out by the different geographic regions of the continent, you see that Northern Africa represents 23% of the cases, and with about, for the West Africa represents 17% of these new cases, with about 10,000 of them. And East Africa, 8.2%, 4,700 cases, and Central Africa, 5.9 percent increase with cases there, numbers. Now, if you look at the cumulative numbers over countries with the highest cumulative number of cases, include South Africa with 80,000 cumulative cases, representing 30% of the infections. And then Egypt has 49,000 cases, representing 18% of the cumulative, 12,500 representing 5%. Algeria, 11,200 representing 4%. Again, let me just repeat, these are cumulative cases. These 5 countries account for 64% of all cases reported on the continent. So I will now transition to what we continue to do as Africa CDC. We last week continued to support member states by conducting virtual trainings in the areas of surveillance, and over 210 individuals were trained through that from 41 member states. Very encouraging to see that we continue to use the platforms that exist to enhance and support countries. 16 individuals were trained on the use of event management systems on the platforms across the continent. We continue to provide training supporting countries like South Sudan, Cameroon, and Zimbabwe on a step-down training for infection prevention and control measures. We've also been conducting both English and French training on environmental and equipment hygiene and waste management of about 570 representatives of member states. And then lastly, we've conducted clinical training on case management for about 230 participants on coagulation laboratory testing for COVID-19. And let me, at this point, give you an update on the testing. We, as of June 16, as a continent, have tested or conducted 3.7 million tests, and that represents about 2,700 tests per million population, with a positivity rate of about 7%. If you compare this with last week, the testing numbers, this increase or this number represents an increase of about 29%. I just insist on that because last week there were some misunderstanding with numbers, and I can understand that when we pronounce these numbers, we use different accents and it may not be captured properly. Of this number, the 3.7 million, 10 countries account for about 80% of the tests. And I'll read those countries slowly. That is South Africa, Morocco, Ghana, Egypt, Ethiopia, Uganda, Mauritius, Kenya, Nigeria, and Rwanda. They all contribute to about 80% of the testing. So that gives you an overall picture that if you subtract the 10 countries from the 55, so 45 countries are still struggling there. So the overall increase in the number should not mask the challenge that we still have with the testing. So I think that is why our PAC initiative, the Partnership to Accelerate COVID Testing, is extremely important. We keep saying we have to scale this up aggressively and boldly so that we can be ahead of a pandemic there. So I think, and if we do that, we have to intensify that with tracing of the contacts, isolation and quarantine, and of course, prepare hospital systems to receive patients that will require care. So let me turn it back to you, Wayne, so that we can do the question and answer session.
Thank you very much for that brief, which also included some activities that are going on here at the African Union, and also by the chair of the African Union, His Excellency Cyril Ramaphosa. Our first question for today comes from Kara Anna, and she's with Associated Press. Kara asks, how equipped are African nations for real-time mortality monitoring? How can you be sure that there aren't far more COVID-19 deaths than are being reported?
So, Kara, that's a very good question, and it's a question that we are aware of and is conscious of. Let me just say that there's more about COVID, the COVID pandemic on the continent that we need to learn about, and we should always remember that we are just about 5 months into the COVID situation. So we continue to learn and report the numbers, including the number of testing, including the number of confirmed cases and also deaths, should be taken in the context of reporting the best we can and from the data that is reported in the countries. We as CDC are working very, very hard to begin to focus a lot on the mortalities in the hospital and hospitalization, so that we can also know what is going on within each hospital, the hospital settings in the countries, so that we can square the number of confirmed cases versus the burden that is being laid on the healthcare facilities, and begin to have a picture of what is going on. Mortality surveillance in Africa as a whole is weak. And before COVID-19, that was one area of focus for Africa CDC. With COVID, we expect that we'll continue to press on countries to collect such data and share, because as the pandemic gathers pace on the continent, that will become a very important area of focus for us.
Thank you for that. We go to Coletta Wanjohi, can assist with COVID-19. That's the first one. Then the second one is, we are seeing increased cases of gender-based violence during this COVID-19 period. Is this something that is coming up in your conversations with member states? Two questions from Coletta.
So, Coletta, those are very good questions. Let me start with the vaccine. So we have, as I indicated at the start of this conversation, where we will be convening a very important meeting next week, and we hope that all of you on this call today or conversation will take part in. And the goal, as I said, was to lay out a framework with specific goalposts on how we as a continent should be positioning ourselves and having discussions with vaccine manufacturers, but also be thinking of how we can manufacture vaccines ourselves. We have good facilities on the continent that can manufacture vaccines. I mean, yellow fever vaccines are being manufactured in Senegal. We know that there are vaccine manufacturing facilities in Egypt, and I believe in South Africa, and I might be missing other countries there. So it should not only be discussing or a discussion of that the UK should have a vaccine and then give us some, or China. It should be a comprehensive conversation that we'll have next week as to how we should position ourselves with respect to developing vaccines ourselves. Secondly, for countries that are developing vaccines like China, the European community, and the United States, what is our interaction and cooperation with them? If you recall, the basic principle of our continental strategy is that we should enhance cooperation, collaboration, coordination, and communication. So I think we take those very seriously. On the gender-based violence issue, I think, let me just step back here and say that we at Africa CDC and the African Union Commission have always said that as we fight this battle against COVID-19, we should make sure that human rights are at the center of the struggle. And that includes everybody. There is gender violence, the vulnerable community populations, and everyone else. I think, I mean, we were very upfront when the lockdowns were being implemented, and there was violence in the community where the security officers were using excessive force in making sure that countries or populations complied to the lockdown. I think we spoke out very clearly. So there's a discussion going on within the African Union Commission on respect to gender-based violence, which is recognized and has to be addressed in public and also in private.
All right, I have just a few notices to give to colleagues who are joining us. The first one is that if you want to talk, you can raise your hand. So press your raise hand icon and we will recognize you. The second is that that WhatsApp number that I promised you earlier, it is +251 945 502 310. +251 945 502 310. May I also encourage those who are watching us on Facebook that if you have a question that you want to put to this press conference, please use that WhatsApp number and we'll be able to respond to your question. We now move on to Sarah, and she's with DevEx. She says, will reporters have full access to the virtual conference next week, or will we only get information from the press conferences? She also asks, where do we register?
Is this Sarah?
Sarah, yes.
Sarah, yes. I believe the links have been publicized, and I see many people in the room nodding their heads. I think we just have to maybe go to our website, and on our website you can register. And I also understand that there's a limit to social media. They can also. Okay, social media you can register. So yes, it's open live to everybody. I think we will have a communique at the end and a press conference at the end. That is on Thursday in the evening. So our regular press conference next Thursday will be shifted to a later time during the day or towards the close of the business, so that we can read the communique to everybody. But it's open to everybody. There will actually be a special session with the media engagement and community and civil society, which I strongly encourage that you participate, not just during that session, but the entire session.
Thank you very much. I just want to reiterate that you can get that information from the two websites. The one is the Africa CDC website, africacdc.org, but you can also go to the African Union website. We have a special page on COVID-19 on that website, and that webpage.
Yes, you're right. The figures as what you stated, and my plea to all countries is that unless and until we have full data from the countries, we don't know how to fight this pandemic. And we are in this together. We are part of the AU, and all member states are committed to this, including Tanzania. What is extremely important to every member state is that you cannot count yourself as COVID-free if other countries have COVID infection there. So we have to be in this all infection there. So we have to be in this all together. We continue to hope and expect that Tanzania, in the spirit of what I just indicated, will come forth with the data. And if they have few cases, only 66 cases, and we know that is truly based on evidence, then as a science-driven organization, we shall be pleased to announce that. But unless we have a full reporting of that, in the true spirit of a good public health practice, it is difficult to ascertain and validate. Collaboration and coordination to have those numbers to the Africa CDC and the World Health Organization is a cornerstone for our battle against COVID-19.
Christina from Portuguese news agency Lusa in Lisbon says, good morning. In recent weeks, a growing number of infections have been reported among health workers in countries such as South Africa and Nigeria. There are also records of strikes or announcements of strikes by doctors in several countries in protest at the lack of protective equipment. What is the Africa CDC's assessment of the impact of the pandemic on health workers? What measures are being taken to respond to this problem? What needs to be done to prevent the escalation of the disease among health workers? So she has 3 questions there.
Yes, I mean, and very pertinent questions. I've said several times during these conversations, weekly conversations, that the healthcare workers are a cornerstone of our response strategy. And because they are the people that protect us, and we have to protect them as well. And it boils down to one pillar of our technical implementation, which is what we call infection prevention control. We are very early on, we recognize the importance of that very early on, which says, that a lot of the infections will happen within healthcare facilities and hospital settings. And we started training people. I think we brought in 39 countries in Nigeria, trained them on infection control and prevention, and we have since cascaded those trainings in several countries. So we recognize that, and we really call on countries to pay particular attention in that